Have you been thinking about CO2 laser resurfacing for your face, but aren't sure what to expect? For the right patient, CO2 laser can make a dramatic difference, but there are 5 things you need to know before you get it done. Hi, my name is Dr. Namita Murthy. I'm a double board certified facial plastic surgeon practicing in Annapolis, Maryland. CO2 laser resurfacing is one of the most effective non-surgical treatments available for facial rejuvenation, but it's also one of the most intense. So I want to walk you through 5 important things you should know before having it done. Number 1. Understand what CO2 laser resurfacing actually does. A CO2 laser uses a specific wavelength of light that targets water in your skin cells. When that energy is delivered, it vaporizes thin layers of damaged skin. This removes sun-damaged skin, fine lines, wrinkles, and uneven pigmentation from the surface. But here's the part most people don't realize. The real magic happens underneath. The controlled heat from the laser triggers your body's natural wound healing response. Your skin starts producing new collagen and elastin, which are the proteins that keep skin firm and smooth. Over the following weeks and months, your skin continues to remodel and tighten. That's why results often keep improving long after the procedure itself. There are 2 main types of CO2 lasers. Fully ablative CO2 lasers remove the entire surface layer of the skin in the treated area. Fractional CO2 lasers treat only a fraction of the skin, creating tiny columns of thermal injury called microscopic thermal zones, or MTZs. By leaving areas of skin untouched between MTZs, the fractional CO2 allows for faster healing and fewer risks with impressive results. Number 2, not everyone is an ideal candidate. The best candidates for CO2 laser resurfacing tend to be adults between 40 and 60 years old with fair to light skin, what we call Fitzpatrick skin types 1 through 3. If you have moderate to advanced sun damage, fine lines, wrinkles, or acne scarring, this treatment can make a real difference. However, if you have deeper skin tones, you're at higher risk for pigmentation changes after the procedure. That doesn't mean it can't be done, but it does mean your provider needs to be experienced. They need to adjust the treatment settings. There are also some situations where this treatment should be avoided. Active cold sores or herpes lesions in the treatment area, recent sunburn or heavy sun exposure, pregnancy or breastfeeding, a personal history of keloid scarring, and active skin infections are all reasons to either postpone or reconsider the procedure. Make sure you have an honest conversation with your provider about your full medical history. Number 3, preparation matters more than you think. A good outcome starts weeks before you ever sit in the treatment chair. Most providers will ask you to begin a skincare regimen about 4 to 6 weeks before your procedure. This often includes strict sunscreen use and sometimes a skin lightening agent like hydroquinone to reduce the risk of dark spots afterward. You'll also likely be prescribed an antiviral medication, usually valcyclovir, starting a day or 2 before treatment. This is standard, even if you've never had a cold sore, because the laser disrupts the skin barrier and can reactivate the herpes virus. Some providers also prescribe antibiotics for patients at higher risk of infection. If you're on certain medications like isotretinoin or topical retinoids, your provider may ask you to stop them before the procedure. And this is important. Avoid tanning beds and prolonged sun exposure in the weeks leading up to the treatment. Sunburned or heavily tanned skin significantly increases your risk of complications. Number 4, recovery from CO2 laser can take time, and you need to plan for it. This is probably the most important thing people underestimate. CO2 laser resurfacing is not a lunchtime procedure. Expect your face to be red, swollen, and oozing for the first several days. Crusting is normal and typically starts within a day or 2. For fractional treatments, most of the crusting and swelling resolve within about 5 to 7 days. For fully ablative treatments, the healing process can take longer. During the healing phase, you'll need to keep the treated skin moist at all times. Your doctor will likely recommend gentle soaks with distilled water or dilute vinegar followed by a lanolin-free ointment. You should avoid picking at your skin, using any harsh products like retinoids or vitamin C serums, and staying away from direct sunlight. After the skin has reepithelialized, meaning the new surface layer has formed, you'll still need to be extremely careful with sun protection for at least 3 to 4 months. Redness can persist for weeks to months, and this is a normal part of the healing process. Plan to take at least a week off from work and social activities. Some people need more time depending on the intensity of their treatment. Number 5, know the risks and set realistic expectations. CO2 laser resurfacing has an excellent safety profile when performed by an experienced doctor, but no procedure is risk-free. The most common side effects are prolonged redness and post-inflammatory hyperpigmentation, temporary darkening of the skin. In large studies, hyperpigmentation has been reported in up to 37% of patients, with higher rates in those with darker skin tones. Less common but more serious risks include infection, bacterial, viral, or fungal, scarring, and permanent lightening of the skin. These are rare, especially with proper pre-treatment preparation and post-treatment care, but they're important to understand before you proceed. As for results, most experts describe the expected improvement as moderate. You should see meaningful improvement in wrinkles, skin texture, and pigmentation, but this is not a facelift. Some patients benefit from a single aggressive session, while others prefer 2 to 4 milder sessions spaced 6 to 8 weeks apart. Your doctor can help you decide which approach fits your goals and your tolerance for downtime. CO2 laser resurfacing is one of the most powerful tools we have for facial skin rejuvenation, but it's a real procedure with real recovery. The 5 things to remember are: understand how the laser works, make sure you're a good candidate, prepare your skin properly in advance, plan for meaningful downtime, and go in with realistic expectations about both the risks and the results. Every person's skin is different, so the best next step is to have a thorough consultation with a board-certified dermatologist or plastic surgeon who has experience with this specific treatment. They can evaluate your skin, discuss your goals, and create a plan that's right for you. If you found this helpful, remember to subscribe for more evidence-based skincare content. And if you have questions, drop them in the comments, and I can try to make a future video on it.